Hi everyone. So now we are in the post-dialysis assessment phase. The purpose of the post-dialysis assessment is to ensure that the patient safely gets off the machine, to make sure that they're well enough to stand and to get home. And today we're going to be leading Eric back. So just so everybody's aware, I've started leading him back. The machine is preset to 100 mils per minute, and that's where we want to keep it. It's very important that as we bleed the patient back, and actually when we bleed them on as well, that we do it at a slow, sustained rate, because the patient's adjusting and they're hemodynamically changing. I know that it might be tempting to up the pump speed to save yourself and the patient literally only a few minutes. However, I'd like you to stop and consider some of the physiological things that might be happening with the patient that you can't see, and we want to ensure patient safety and that we're following best practice. So as the patient is getting their blood back, this is an appropriate time that you could take their temperature. Once again, ask them, how are you feeling, Mr. Eric, after your treatment today? Good, that's good. And it does look like you were able to achieve your full goal today, so that's great. So now the patient's blood is back. We can see reinfusion volume completed. So at this point, we are going to take their blood pressure. So I'll and also just be aware that over the course of the treatment, the blood pressure cuff might have moved, become loose. Just take a moment to just check. That seems actually like it's quite fine. But if you needed to readjust, please do so, because we want to make sure that the blood pressure numbers aren't skewed by the cuff being too loose or out of place. So when the reinfusion was complete, I checked that the blood pressure cuff was good, took his blood pressure. I did clamp the venous line as the blood pressure was being taken, but note that I did not disconnect him yet. That's because I want to be sure that once the blood pressure is taken, that I assess what the blood pressure is, and I make sure that that is safe and okay for that patient. Lots of times you can consult with the patient as well, because the patient knows themselves quite well for the most part, and you want to consider, the patient is sitting right now. Potentially we would put down the patient's legs, and we would give his body time to adjust before he stands up. Some patients, when they stand up, as we know, their blood pressure can drop. So I want to be sure that with a sitting blood pressure right now of 138/89 and a pulse of 98, that is a safe blood pressure for me to go ahead and disconnect the patient. If I felt for whatever reason, let me silence that. If I felt like for whatever reason at this point that his blood pressure was low, he was symptomatic, we know it's low and he's going to take possibly a dip when he stands up. At this point, because he is still connected, I could go ahead and open up the venous line, and I could continue, as long as there's saline in the bag, that I check that there's saline in there, that I go ahead and I can slowly give him a little bit more fluid in small increments, continue to let him rest, clamp the line, take the blood pressure and reassess again. So I think today we don't really need to do that, Eric. You seem fine. Blood pressure's okay. If you're not sure as well, you can always go ahead and then check the trends for the blood pressures. I've already looked at his intradialytic blood pressures. They've been quite stable today, so I'm happy to go ahead and disconnect. So the patient's blood is back, like I said. I've secured the line, flushed and locked it with the appropriate medication. I have also secured it with some gauze. And you just want to make sure that you ask the patient some questions before they leave. So any cramping, shortness of breath, dizziness, we'll assess that as well when you stand up. Overall, you're feeling well to leave. Wonderful. I'll take your blankets there from you. Okay, so the patient has sat up. He's just letting his legs rest and getting his bearings. So while he's doing that, I'm just going to come to the post-dialysis assessment screen, and I've just put in that I'm the staff on. I've ensured that the temperature has been plugged in that I took earlier. Here in the patient assessment box, again, this is where we can write some subjective information based off of our assessment. But today I feel that we have had a pretty uneventful treatment, right, Eric? And I don't really think so far in my assessment that I have anything to write there currently. So I'm going to go ahead and save that. I am also going to go to the assess screen, and I'm going to tick off the appropriate, more objective things that have been done. So I am going to say that he has had his access hourly check, his CBC packs are applied. So far, I believe that his discharge is stable, but I'm actually going to wait until he exits the unit to tick that. He didn't end his treatment early. We are going to heat disinfect. Routine labs done post. No, there weren't any done post. They were done pre. And he is not discharged hospital. I did check lab results. And so as of right now, that's what I'm going to tick. So I'm going to go ahead and save that as well. And if Eric is ready, he certainly can stand. Okay, so I've taken Eric's standing blood pressure. Once again, I'm going to ask him, are you feeling well? You're feeling good standing, no dizziness? Okay, good. Blood pressure seems robust. Okay. Also take time to consider your patient's mode of transportation. You know, I want to be very certain and confident when I discharge this patient, if he's driving home, that he is safe to go behind the wheel of a vehicle. And you are driving yourself today?
That's correct.
Okay, perfect. So we're going to take your blood pressure up. And I'm now going to walk with Eric to the scale. Great. So we're going to get Eric's weight. Alrighty, perfect. Wonderful. Alright, thanks again, Eric.
Thank you.
Like I said, have a wonderful day.
See you next time.
See you next time. Okay, so the patient has left the unit, so I'm going to come back to the screen, and I am going to put in here his weight. I'm going to make sure that the blood pressures did record, and I am going to go ahead and press save. I'm also going to go back to the assess screen. I'm just going to finish off any of the check marks that I didn't tick off before that I now feel very confident that he was discharged stable. And I'm going to now also take a quick look at the blood circuit. So I'm going to check for clotting. So I'm going to check streaking of the dialyzer as well as the top of the dialyzer. I'm going to be checking the venous chamber for clotting, and if there's any clotting moving up the transducer. And overall, the lines look what I would classify as quite clear. So I'm going to go ahead and document that as well. Also, I'm going to press remove blood lines. And those lines are going to get auto-rejected while I go back to charting. Transducers are clear, so now I'm quite confident to go ahead back to my post screen. So I'm going to go ahead and put the dialyzer rating as clear, and I am going to press departure time. So the patient has departed the unit. I'm just going to say now. Okay, that documents the patient has left stable. Again, I'm going to have to save before I go over to my medication screen and make sure that I have indeed signed off the meds. So I did instill the sodium citrate when I locked the lines. So I'm going to go ahead and document that I did that. Okay. And again, I don't feel that it's necessary because we're charting by exception in the assessment boxes to put anything today. If there was anything, again, by exception that was out of the norm or you had concerns about, you'd like to have that be relayed and documented for other nurses and care team providers to see, you would definitely write something there. So now I am ready to go ahead and pull the patient card, and we have completed our treatment.